Uh, Good evening. Before going on through the upcoming lecture, I would like to remind you that our aim through the studying of geriatric medicine by reducing the demand among the elderly to improve their capacity and putting a management strategy to improve their performance and health condition, and also care for the caregiver who is assisting or helping us to look after our elderly people. Now let's start our lecture. Our lectures today will cover actually three topics: geriatric assessment and capacity, the elderly abuse, and caregiver role and what's facing them during caring for elderly population. As we know that over the last decades, the world elderly population has increased exponentially, and this tendency will continue during the coming years, from 2000 to 2050. Actually, people over the age of 60 will double, and those over 80 will quadruple. The loss of independency occurs as people age due to mobility restriction, frailty, and decreased functional fitness and cognitive ability. Evidence has shown that appropriate programs and policies contribute to keep older adults healthy and independent over time. Okay, such policies will serve the community a lot because it will decrease the incidence of consuming of the health services, the incidence of dependency of the elderly population on the other. Okay, healthy and the purpose of this all will interact together to decrease the incidence of functional decline among the elderly. And can be done through the proper comprehensive geriatric assessment that must be serviced and introduced to all elderly during their attendance and seeking their medical services. We can do the geriatric assessment actually through many parameters: the physical health, the mental, the functional evaluation, the social functioning, and the surrounding environment, which have its effect on the elderly people. Actually, as we said, that the comprehensive geriatric assessment is playing an important role in determining the functional capacity and the limitation and disabilities among the elderly population, in aim to improve their quality of life, decrease the comorbidities, and improve care clinical outcomes. This can be done through non-medical domains or emphasizes the functional ability or quality of life for elderly, and improving care عن طريق greater diagnostic accuracy, improving functional mental, decrease mortality of comorbidities, okay, and decrease use and keeping in nursing home or institution or long-term care, because all of these are exposing the elderly to great hazards. Okay, although it's serving the elderly, but elderly on long stay on it are exposed to many hazards, and the greater satisfaction with this care which is being reduced to the elderly. The component of assessment and in its proper way to be done is through the history taking, and remember there are general guidelines that we must follow, especially geriatrician or GP on meeting or introducing the service to the elderly population. We all must remember that patient having age-related changes in one or more body system. Okay, so that the finding on such elderly population will be have a complete different profile or appearance or the way of diagnosis than that found in much younger age. Okay, we must keep the pace slower than usual, okay, and give the elderly his full time to complain and speak freely and say all his complaints, and we must title them. We must introduce ourselves in start of the history taking to make a friendly and relief for the elderly from any stresses that may affect or will appear in any of his physical examinations or vital signs or during the vital signs taking. We must address each individual as per her or his preferences. Sir, Madam, Professor, your kindness, and this is better to be used or titled than grandpa or grandma, or titling them with or nominating them with words that he don't like actually. We must adapt the most effective way of communication, such as do not discuss the case with relatives as if he is not here, or speaking about him as if he is ignorant or not a person. Can he express his feelings or speak about himself freely? We must never, as we said before in the last point, never ignore the presence of elderly and ensure that he is hearing us properly. If he needs an hearing aid or any way of communication to facilitate the process of communication and say his complaint in full. Provide a glasses if needed, speak at eye level and facing the patient, speak clearly with a clear voice, okay, and without any difficult or complicated words. And never treat the elderly as a child, okay? You are advising a child or something like that. And respect the elderly as an individual. After that, we will move to the subjective information and personal history, which will make a clear vision about the elderly, okay, or the patient, and will help us in evaluating all his conditions, medical, either medical, social, psychological, etc. Okay, we must take his age, sex, education, socioeconomic, his chief complaint for evaluating his multiple pathology or comorbidities, the presence of physical illness as chronic diseases, previous hospitalization or surgical procedures have been done to him, or if he's using a hearing or visual aids or something like that, sensory aids. The drug history, his prescriptions, his full investigation have been done, full medication to this is to help us to put a plan for him to avoid drug-drug interaction or the side effect of some medication. Then his nutritional history, the number of meals, then the family history, if this illness that the person exposed to are hereditary or familiar, and the genetic is playing a role in its presence. Later on, we do complete physical examination, okay, which is a very important part in the comprehensive geriatric assessment. We use the we evaluate the height, the weight, the body mass index. We measure the vital signs, the blood pressure, the temperature, the pulse, the respiratory, and we make a special concern or concentrate over the orthostatic blood pressure, okay, because elderly is usually exposed to the presence of orthostatic hypotension, okay, which increase the incidence of falls and fracture. The presence of edema, cyanosis, skin integrity, the pallors, and the special concentration for the skin, which must be examined carefully for early detection of any pressure ulcers or changes or infections, skin infections, and so on, okay, or any skin changes. And actually, a lot of diseases can be diagnosed even from the skin integrity. Then we evaluate the range of motions for the musculoskeletal system evaluation and the incidence of falls, which may have impact on the elderly if the incidence of fall is that high on the elderly person. Then the sensory states, the vision, the acuity of visions, okay hearing, which allows his social communication, and the level of coordination, in the musculoskeletal system. Then we evaluate the functional status of the elderly population as his dependency on the personal, on his activity of daily living, the activity of bathing, grooming, feeding, and so on. Okay, and this can be classified into 3 grades. Okay, either he is independent, he is assisted, requires, okay, and he is fully dependent. The more complex activities essential to life in the community in the form of instrumental daily activity, we can evaluate the balance between modified performance, okay, through the mobility assessment scores, okay, and the GATE scores, which is ranged from 12, the balance scores, and then both of them are helpful in evaluating the persons and the degree of risk for falls. Either he is less than 19, he is at the risk of high falls. Between 19 and 24, it is medium. At the incidence of 25 to 28, he is low risk of falls. We evaluate the GATE, okay, by timed up and go test, okay, the mini-cock test assessment instrument for evaluating the cognitive function of the elderly. Actually, the domains of functional abilities that will help us to evaluate the capacity and the functional performance of the elderly is if we found that he can move around, serve himself, is fully dependent, build and maintain relationships, okay, that he is usually socially involved, that he is keeping his good relationship with others. Okay, that he can actually meet his basic needs from feeding, from preparing his food, from instrumental even by buying the food and dealing with money. His capability of learning and growing his talent and make decision, okay, for this evaluating his cognitive abilities and then contributing with others either in social activities or in helping other peoples or even contributing by his opinion in some issues. One of the important domains that we must concentrate during evaluating and doing the comprehensive assessment is the nutritional history, which is the types and the quantity and frequency of feeding, the special diets habits he is following, the use of vitamins or supplementation, any weight changes, either losing weight or gaining weight, okay, the amount of money if he is facing any financial problems, okay, so that he cannot feed himself, so this or buying food, so actually he will be exposed to malnutrition, accessibility of the kitchen and food storage, any problems physically that will affect the process of nutritional intake or feeding, as any problem within the mouth or the digestive system. All this will have impact on the nutritional state of the elderly individual. Actually, the mental health is very important in evaluation of the cognitive function and the psychological aspect of elderly, where insomnia and lack of sleep and sleep disturbance, okay, all these changes in sleep pattern will have its effect on the power and the concentration, the mood of the elderly. Also constipation, the cognitive dysfunction, the anorexia, fatigue, all this will have its impact on the health and the functional capacity of the elderly. So we must ask about during evaluation for any psychological aspects, okay, such as delusion or hallucination, prolonged depression states, okay, the intake of psychoactive drugs, and recent changes in circumstances. Any mood change or cognitive change must take our concern, and we must pay attention closely to it, okay, because maybe any signs for the deficiency or decline on the cognitive function, okay, and may be early symptoms of depression. Actually, as we know that the resilience is the capacity to recover quickly from difficulties and toughness of cases that may facing the elderly population. Psychological resilience is also very important, which is the ability to mentally or emotionally cope with any crisis, okay, and overcome any obstacles. Although the physiological resilience is very important to increase the functional capacity of the elderly. So, in collectively, we can define resilience as the ability to maintain or improve a level of functional ability in the face of any adversity, either through the resistance to the situation or recovery from it, or adapting to these obstacles and overcoming. At the end, from all this good comprehensive geriatric assessment and the aim of increasing the functional capacity and the functional activity of the elderly is to increase his functional independence, okay, and to relieve all his pain, to increase the range of motion and become fully independent on other, to maintain his strength and endurance of movement, and also to decrease or limit the comorbidities and impact or complications that may affect the health state, okay, and maintain him ambulatory and can be participating in the social life and involved in it and be an active person as much as possible to avoid the increasing incidence of depression, suicide attacking, keeping in a long-term care or institutions. All this will have its impact or have many others that will affect the elderly population and increase the health problems, okay, and will be burden on his caregiver or the surrounding. Also will be burden on the health services that is introduced to such handicapped elderly due to many obstacles and no proper geriatric evaluation or assessment. So that our home message from good comprehensive geriatric assessment and the aim of maintaining healthy aging through the health assessment and monitoring through proper nutrition, the physical activity, the comorbidity, the vaccination, the mental health, the vaccination, improving sleep, so, okay, and environmental control, injury prevention, and public health education. Now we will move to the second topic, which is elderly abuse. Actually, elderly abuse is one of the most common issues and that we must focus upon serving or helping elderly people, okay? Because elderly abuse is more common than you might think. And we must learn how to spot the warning sign and what we can do to help an elderly patient, persons or patients at risk are exposing to any kind of abuse. Okay, and actually, this we are seeing this issue actually a lot every day. Actually, at first, we must identify or defining what is abuse of older adults. Actually, it is defined as by the WHO as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distresses to an older person. And actually, there are many types of elder abuse. Actually, there are six types of elder abuse exist. At first, the physical, which is in the form of hitting or kicking or slapping the elderly or turning or forcing him to do something and which is beyond his capacity or ability. All this will end by causing injury or increase the incidence of fractures or falls among the elderly. The second type is neglect, which is actually the failure to meet the elderly basic needs and the most common form of these are like leaving him hungry or thirsty or without proper clothing. sheltering or supervision on healthcare. All this will put the elderly in a dangerous situation. Okay, and it's very common among the elderly, especially when they are not served by their relatives or the surrounding. Third type is the sexual abuse. Sexual abuse is engaging in any sexual act without his consent, actually. Okay, his emotional abuse, the emotional abuse, which is harming self or naming or calling or securing the elderly. The fifth type is the financial, which is illegally misusing an elderly money, property, or assets. The last type is the abandoned, which is leaving elderly alone or not provide or no longer providing care to him, or there is no one caring for such elderly. What does this population longevity mean? As ages increase, okay, so the number of health, social, psychological issues that make older people more dependent will be increasing, okay, as increasing the lifespan, so that means that elderly person, if, especially if having any health issues or health problem, okay, will be burden on his surrounding, her caregivers, okay, with health services, will be burden on him financially. Okay, so all these are interacting or integrated together to form a great problem for the elderly and his community. Especially that most of the elderly are suffering from chronic illness and the needs of many medication, especially when these medications are costly. The instance of depression and dementia increase the quantity and the quality of the social support, the availability of the proper institutions or the long-term care services is not that much in our population. All these are a serious problem that may face the elderly. The decrease in reserves and the increase in vulnerability to abuse or vulnerability to expose to more serious health hazards. The physical abuse actually is a physical force that may result in bodily result in injury or pain or impairment. Okay, it can be caused by an object or without. Okay, it will appear to us and can be apparent on the elderly, and we must pay attention to it. It will be in the form of bruises or black eyes, lacerations, bit sores, punctures, cuts, restrain marks, okay, dislocations, increase the incidence of falls, also can be found through the laboratory findings as the increased incidence of anemia, which is an indicator of malnutrition, or no adequate iron or folic acid, etc. intake. Okay, also his medication are not taken on a proper way, used both or overdose. The patient or the elderly, if he's aware enough, he can report that he's being hit or slapped, okay, or mistreated. Okay, sudden change in the behavior of the elderly, like increase the incidence of depressive episodes or depressive attacks, okay, the suicide attempts, the depressed mood or swinging in his mood, asleepness, all this is an indicator that this elderly is facing a serious problem, okay. The caregiver might refuse to allow his relatives or his visitor to communicate, so that they cannot detect the signs of abuse. Okay, all this is a serious medical legal problem that we must pay attention for. The risk factors which can make the elderly is more vulnerable to be exposed to kind of abuse is that he is usually elderly above the age of 80. Okay, is more such age are more likely 2 to 3 times or folds higher to be abused than in younger age. Okay, females are more exposed to be to the being abused more than males. Okay, also, if there is any cognitive impairment and developmental disability, the poor physical health state and disabilities, the mental illness or psychological problem, also low income or low financial, so that he cannot be served in a proper way, or not an educated caregiver will be available for him. Also, if he is dependency, either socially or emotionally or physically or psychologically, okay. All this will making this such a person are more at risk for being exposed to the incidence of abuse. Actually, as we said, that the elderly are exposed to being abused, so the abuser himself is exposed to many factors that make him such an abuser. Okay, as he is facing financial problems, okay, or depressive symptoms, he is overloaded by his social duties towards his families and also the duties towards the elderly who is, to whom he is paying attention or care, looking after. He felt that he has a poor emotional states and rule limitation in activities. Okay, also substance or alcoholic abuse or addiction. Okay, also people who feel he is stressed, burdened, or resentful are more likely to be abusive. As we say that there are signs or red flags that can hook our awareness, okay, about if the elderly are being abused or not. Okay, such signs we must pay attention during evaluating the elderly or ensuring that he is not exposed to any kind of abuse. As these signs are either weight loss, his appearance is not in a proper way, dirty clothing, or poor hygiene, the presence of pressure ulcers, okay, skin infection, increase the incidence of UTI, the dehydration, and he is not taking his medication or not receiving his medical service in a proper way or follow up. As we say that not only the caregivers or the care that's introduced to the elderly in the home is not only that is can be a kind of abuse, okay, or facing abuse during it, also during his long stay in institutions or long-term care facilities, okay, he can be exposed to kind of abuse. This can be either abusive assaultive behavior as slapping, pulling hair, abusive treatment like practices, lack of practice and public toilets. He has no privacy. There are not passed in proper way like group passing or lack of passing or exposed to the incidence of infection or pressure ulcer. Also, abusive attitude towards the elderly to whom we are directing the services, or as using restraints or keeping isolated or not taking them for outdoors for a time. Okay, all these are kind of abuse to the elderly who are kept on such places in aim to have a full medical services and to improve their situation. The predisposing factor in institutional abuse is or the facility risk factors is can be titled under the staff turnover, the caregiver stresses, the absent or inadequate prevention or practices, okay, to the people who are introducing or serving such an elderly population. Where should awareness be highest? Actually, on the accident or emergency department, the orthopedic units, the geriatric clinic, okay, and the old age psychiatry, and the primary care for elderly people, okay, on urban or rural areas. And screening instruments must be used and applied for evaluating the risk, evaluating the abuse or kind of abuse that may be the elderly exposed. Actually, for clinical management of such abuse, we can do by the early detection, okay, if has abuse occur or not, the proper assessment of his state, okay, either mentally, functionally, okay, or medically, planning for intervention and follow up to be ensured that there such person or elderly are not exposed to any kind of abuse in the near future. Now we will talk about and discuss our last and the third topics, which is the caregiver. At first, we must know that they are helping and offering us a great help in caring and looking after the elderly population or the beloved ones to whom we are caring. Okay, actually, a caregiver cares for the health and well-being of someone who needs help with daily tasks and activity. Our aging loved one may need a caregiver because of an injury or immobility, memory issues as dementia, illness or chronic conditions, fractures, bedridden, okay, that make everyday course a more complex and challenging issue, and not all of us can actually available for his elderly relatives or for the elderly person whom we are looking after, okay, so that we are in need for the caregiver, especially when those caregivers are highly practiced and acting on a professional way. They will be offering us a great help and will make the quality of life for the elderly people and for us much more better. Okay. So let's define the caregiver. As we said before, is the person who is trained to assume responsibilities for the physical, emotional needs of another who is incapable of self-care. Okay, those are many types. In يكونوا supportive home caregiver أو personal care workers أو personal care ID and actually, let's start by defining the caregiver. Actually, the caregiver is a person who is trained to assume responsibilities for the physical, emotional needs of another who is incapable of self-caring and who is in need of assessment and the dependency or caring after looking after him. Okay. There are many types of the caregiver. They are maybe a personal care workers or a community-based residential facilities, okay, or supportive home care and etc. There are many duties that lies upon the caregiver, which is companionships or personal hygiene, help in personal hygiene. Okay, also medications reminders. Okay, They can help us, they can help the elderly in feeding, enjoying his time, meal planning, transportations, medical health care. They are, by time they become part of the family, okay. Also caring for assessment or pet caring even. All these are lying among within the limits of the duties of the caregiver. Actually, let's start by defining the caregiver. The caregiver is a person who is trained to assume responsibilities for the physical and emotional need for others who are incapable of self-caring or needing an assessment. There are many types of the caregiver. They are either community-based facilities, caregiving facilities, or personal care workers, or supportive home care workers, and etc. Actually, there are a lot of duties which rely upon the caregiver, and he must be aware of and taking care about maybe assisting in personal care, assisting in the food preparation, the mobility assessment, the personal supervision, the emotional support, and the recreational time, okay, and general health care, supervision during medication, backup care, and making home organization. He is actually by time became part of the family, maybe even taking the pet care assistant. Actually, as there are many duties lying upon the shoulder of the caregiver, okay, so all this may be acting as a burden or load upon him, especially if he has also his own life and own his social duties like caring or looking after his family, bringing money, paying groceries and equipments, okay. All these are so that he is the double actor, and actually he is doing two jobs on the same time, okay. That's exposing him to be also exposed to kind of abuse or fatigue, because he may be there may be a little or no caregiver self-care, unrealistic assumption after about caregiver responsibilities, so that we are loading him with more and more duties than beyond his original duties, okay. Inadequate support systems, as no financial support or no health care services for him, or he is not taking adequate foods or nutrition. There is denial of the outcome of the illness. In this slide, we are uh, repeating the caregiver tasks or duties that must be aware, and also the family or the relatives of the elderly person or the elderly who are in need to be assisted by a caregiver must be aware of, okay, so that they cannot upload or يعني إن هم يحملوا الcaregiver any extra duties beyond his original ones, okay. Like the personal, he's looking for personal care, the household tasks, the emotional support, transportation, finding and arranging care while away, having a good communication with the elderly, like reading with him, go to theater with him, okay, recreational activities, okay. And also seeking information and talking with healthcare providers, so that he can be can act in more professional way, and he is highly educated about the different tasks and different options and different duties that he must be aware about. Actually, all these are exposing to the caregiver to stresses. Okay, he may feel frustrated, guilty, lonely, exhausted. Caregiver stress appear to affect women more than men. Okay, where about 75% of caregivers who report feeling very strained emotionally or physically are women. Okay, actually, because they may be looking after their own family, their own children, their own life, okay, and they have an extra duties towards the elderly people whom they are offering their assistant um, caring looking after them. How can we prevent such stresses or situation that burden the caregiver? Okay, by taking normal breaks and scheduled vacation, by eating 3 or 4 meals per day. Okay, have adequate sleep, periodic check up for his health state. Okay, doing exercise and stretching. Not loading his mind with the issues of the elderly during his vacation time. All this may help in relieving part of the stresses that the caregiver are facing. Thank you all for your attention and concern. I wish that everything was that clear. Okay, thanks for attending.